Hey everybody, my name's Mike, and today we're going to talk about something that I teach my patients almost daily in the clinic, and that's going to be balance. Now, whether you have dogs walking around your house or you've just noticed that you've lost balance on the golf course, hiking, doing whatever you want to do, let's talk about how we're going to address that. So, one of the first things that happens is that people start to have a little bit of a slouch. Now, everyone thinks of a slouch like this, right? And that's true for a lot of us sitting at our computer, we get hunched over. But if you're doing something outside of that and you're walking around and still noticing that you're falling and tend to be losing your balance backwards, a lot of times you'll be sitting like this. You notice my chest is a little bit further back from my hips. I'm getting a really big sway back. And if I really concentrate, I can notice that my weight is in my heels. Now, this is really important because obviously our heels are a big piece of bone. They're designed to hold a lot of weight, but that doesn't mean they should be. Now, a concept I want to talk to you about briefly is called proprioception. In your hands, you have your fingertips and you have your heel, your wrist, if you will. And now you can see where I'm going with this. Think of your wrist like your heel. We can feel it. It can hold a lot of weight. We can do push-ups into our wrist, but it's not going to give us all the input that we want. We feel with our fingertips. Our brain gets a lot of sensation from our fingertips. It can tell what's going on, can tell what we're picking up, exactly how much muscle to use, etc. Same thing goes for your feet. So in the front of your feet, we have our toes. We want them to be able to grip the ground. Think monkey feet. You can grab the ground underneath us, right? But also our heels are going to help us maintain a lot of our body weight and support. So when we're standing here, when we notice that we're swayed back a little bit like this and we have our weight into our heels, we're going to get our weight up and over our body so that our mass is pushing straight down into the balls of our feet. You could start to feel your toes grip. You feel your heels lighten, but they don't come up off the ground. We're not doing a heel raise here. I'm not trying to turn you all into ballerinas, okay? But we're going to evenly distribute our weight throughout our entire feet here. So now you'll notice that instead of being back here where my body weight is pulling me backwards so I'm more likely to fall, what you're going to notice is that as I step into here and I get my weight towards the front half of my feet, using my entire foot, now my body is centered over my base of support. So now when gravity goes down through me, it pushes all the way down in through my feet instead of dragging me back behind my feet, causing me to lose balance. All right. So we're going to reset our posture, not worrying too much about where our shoulder blades are or anything just yet. We're going to get our body weight forward, down over our feet so that we're properly aligned and ready to go. Then we're going to progress into walking. So to recap, if we're noticing that we're falling backwards or losing our balance in any one given direction or overcompensating to try to get our body weight back forward, we're going to stop what we're doing. We're going to get our weight into our feet. We're going to get our body weight forward so that we're centered over our feet. So we start to feel our weight go towards the front of our feet. And then we're going to initiate our walking from that position. Now, we already have our proprioception. We have our balance down pat, right? So we're in a good standing position. We're ready to start walking. What we need to do next is we need to take our weight from our feet and transfer it so that we can initiate a step forward. A lot of people miss this part, but this is considered a reflex. This is your stepping reflex, okay? Your body is going to try to avoid falling. Every step that you take while walking is just you preventing yourself from falling flat on your face, right? So as we get our weight forward, we're going to instinctively take that step and start moving. Now, I would like to caution everybody. This is not medical advice. You need to work with a local physical therapist or me. If you want to do it digitally, shoot me a message. But what you want to do is you want to take this in stride for the general population. Now, if you have Parkinson's disease, if you've had a stroke, if you're dealing with any kind of neuromuscular issue, I want you to reach out to that healthcare provider. This is for basic starting points for balance and vertigo care, and to help our body learn our proprioception so that we can start to take that extra step and get on with our day, whether it's shooting a 69 at the golf course or just going on a hike or even grocery shopping. And finally, the last part of this, has to do with vertigo. So you heard me mention it just there a second ago. With vertigo, what happens is our inner ear, that vestibular system, is out of whack. It's not calibrated correctly. It could be overstimulated. It could be underperforming. What we're going to do is we're going to figure out what other parts of the system we can help manipulate. Now, with your physical therapist, your audiologist, you've already figured out what's going on with the inner ear. Maybe you've corrected for those crystals out of place or done your Epley maneuver. What we're going to do here is we're going to say now that vestibular system is overactive, okay? And what I'm noticing here is that, going with what we've talked about before, our proprioception is underperforming. We don't have good, accurate proprioception. We can't feel the ground underneath us. Our proprioception is our ability to sense the ground underneath us so that we know where we are in space. So our brain is using our inner gyroscope, or our vestibular system, our inner ear, to tell us where we are in space, our vision to see where we are in space, and our proprioception to feel where we are in space. Now, some people don't have vision. Some people don't have sensation in their feet. Some people have issues that pertain to their vestibular system, like Meniere's disease. There's a lot of other medical reasons why people would be lacking in one area of their sensory input compared to others, and those are going to be special circumstances. For a general vestibular issue or a general vertigo issue without those other outlying factors, what you're going to notice is that your proprioceptive input is generally down. Okay, so we have to reestablish good proprioception by doing what we did earlier, getting our weight forward, getting our weight into our feet so that we can feel the ground underneath us, and waiting there for a minute. Maybe we even do some heel raises just to get some activity through there. And let's let that vestibular system calm down a little bit. So if you're going through a POTS flare-up and you need your autonomic nervous system to calm down, and you're in a safe place where you can stand, or whether you're having a bit of dizziness or spinning like a vertigo flare-up and you're in a safe place where you can stand, get your weight forward into those feet, establish good proprioception, keep your eyes open so that you can see what's around you, and allow that vestibular system to regulate back down so that it's not trying to overwork for a lack of input from the other symptoms. Now, give me a click and follow me if you like what's going on here. But if you'd like some more information on this, feel free to reach out to me directly and I'd be more than happy to work with you. Have a good day.